Hello, my name is Madisen Hunsaker, and my case study presentation is on pseudoaneurysms today. The patient at hand today is a 74-year-old female who had a recent angiogram because of an assumed restenosis in her right subclavian artery. The patient had high blood pressure and had a difficult time using her right arm. So she underwent a right femoral puncture and was catheterized. Her baseline hemoglobin at the time was 10.9, and this was the third procedure done on that right femoral artery. Shortly after the procedure, a large hematoma with discoloration to the skin was noted at the site of insertion. At that time, the patient's stats were 100 beats per minute and her systolic blood pressure was 80. Her hemoglobin had decreased to 9.3, so an echocardiac was done to ensure there was no pericardiac effusion. The patient was sent home at this time and 2 days later had a sudden and reoccurring right groin pain while she was walking around her house. Here is a little explanation of what a pseudoaneurysm is. It's also referred to as a false aneurysm, and it's where basically there is a puncture in the artery causing a pocket of blood that is circulating through the extra area there. Another transverse example is C over here, showing the pocket. So once that patient had her pain, she came back to the hospital. Her stats were taken again. She had a 90 systolic blood pressure. Her heart rate was at 120, and her hemoglobin had dropped even further to 8.7. So at that time, she was given a packet of red blood cells and monitored. By nightfall, the hemoglobin level had dropped even further to 6.8. An ultrasound was ordered of the right leg, and it showed a femoral pseudoaneurysm with an overlying hematoma, and the hematoma was actually shown on CT. So a compression bandage was applied to the site of injury, and the patient was given 2 more pints of red blood cells and 3 units of plasma. All antiplatelet drugs were stopped at that time, and the CT was ordered. So here is a picture of the ultrasound showing the pseudoaneurysm, just kind of pocketing out of the superficial femoral artery, and all the anechoic area bordering the pseudoaneurysm is the hematoma. A pseudoaneurysm is a pulsating encapsulated hematoma in a communication with a ruptured vessel. I'll be able to show you a picture of that shortly. The case at hand describes a femoral pseudoaneurysm because of the cardiac catheterization, which is the site of the pathology is most often seen. They can arise spontaneously or from medical complications, and in both cases, you are concerned, they can rupture, they can cause the patient to bleed out and die. In this case, the blood leaked out of the artery and was gathering right where the catheter was inserted. They can also occur in other arteries because of infections, rupture of an aneurysm, surgery, and blood trauma. They are most commonly detected with Doppler ultrasound, but they can also be seen on CT and MRI. So this is a good picture showing that this is for sure a pseudoaneurysm. You can see the neck of the aneurysm, and you can see the flow of blood. It's called the to and fro sign. And if this was just a basic hematoma, it would be anechoic to complex, depending on the age and stage. So like I kind of said in the previous slide, sonographically, The aneurysm is going to appear as a rounded sac in close proximity to the parent vessel, and it's going to have a connecting neck between the two that the blood flows through. The internal appearance of the sac will be variant depending on how bad the thrombosis is. A partial rupture may look like a complex or multi-bedded little configuration with multiple interconnecting sacs. And a complete rupture may lead to a more diffusely infiltrated hematoma, which is what we have in our case today. Once the contrast-free CT was done, it shows a low attenuated round structure arising from the parent or donor artery, and the highly attenuation hemorrhage adjacent to the aneurysm is indicative of the rupture. When you have a patient that could have a potential pseudoaneurysm or regular aneurysm, there are 3 signs to look for physically on the patient before a Doppler even needs to be done. And the first sign is an expanding pulsating mass. You can assess the mass with between your fingers to see the size of it and carefully monitor it for increasing size. The other 2 signs are the presence of a bruise over the artery and tenderness over the catheter site. If 2 of the 3 signs are present, either an atriovenous fistula or the pseudoaneurysm should be expected. If the aneurysm is less than 2 centimeters and not enlarged at all, they can usually be managed conservatively without any kind of interventional procedure. So here's the CT with contrast showing the femoral artery there, the neck of the aneurysm, and then you can see the big balloon of the pseudoaneurysm. Once you get a little farther down, right below the aneurysm, you can see the diffused hematoma and how much larger this leg is, and you can tell that it's been there for a little bit. It's pretty complex and not good. So what do we do about a pseudoaneurysm? The first step to treatment is a UGCR, or an ultrasound-guided compression repair. Compression to the neck of the aneurysm is performed while the ultrasound monitors the flow through the vessel and the sac to see when the flow will stop. If that is not successful after multiple attempts, usually it can take compression with that 2 or 3 times a day, anywhere from like 10 to 100 minutes, kind of a therapy of sorts. But if that doesn't work, the next step would be embolization of the neck of the aneurysm, and this is performed by filling the aneurysm with thrombin, which is a blood clotting medicine, and this can be a little risky. It can cause anaphylactic shock in some patients. The gold standard of treatment is surgical closure of the femoral pseudoaneurysm, and this can be done with just stitches, or sometimes a patch has to be made to close the neck. Surgical intervention is recommended if there are signs of infection, rapid expansion, the other treatments have failed, or critical limb ischemia, like blood is just not getting to the vessels it needs to. Any patient that is concerned of having a pseudoaneurysm should have their blood pressure controlled and any and all anticoagulants stopped immediately. The differential diagnosis would be an atrioventral fissure, which I kind of talked about earlier. And that's all. Okay, thank you.